Students, I'm Yvonne Stapp for Science for the Public, and I welcome you to today's Contemporary Science Issues and Innovations. And today, we're concerned with the kind of air pollution that has been identified closely with fossil fuels. And our guest has been very much involved in a study that is very important in this respect. Joel Schwartz is a professor of environmental epidemiology at the Harvard Chan School of Public Health. He's particularly noted for his work on the health consequences of exposure to pollutants, including lead and the effect of air pollution due to fossil fuels. Today, he'll discuss what his research team, using advanced technologies, discovered about particulate pollution associated with the fossil fuels. This work has received a great deal of attention in the last couple of years, both for distinguishing the fossil fuel particulate pollution and from other types, and for indicating its serious health effects. Dr. Schwartz, welcome and thank you for joining us.
Thank you. My pleasure.
And I'd like to start by just introducing a little bit about your study, if you will, that this was a 2021 study, and I believe it was an international research team, and it was about the pollution, the health effects of the pollution from fossil fuels, and it listed a 20% mortality rate that was apparently quite a surprise, at least to the rest of the world. I'm not sure about your research team. Would you comment on that?
Sure. So there have been studies looking at the effects of air pollution. And by here, let me clarify that I don't mean carbon dioxide, which is important for global warming, but doesn't particularly affect health. These are other pollutants in the air that do affect health. And most of those studies, had come down at around 6 million deaths per year from air pollution from all sources. What we found was that when we looked just at the air pollution from fossil fuels, we were seeing 10 million deaths in 2012. Which was the year we chose to look at. And so that was a little surprising, but, I think we understand why. A lot of previous studies, when they estimated the effect of air pollution on mortality rates, used air pollution in populations that they studied and came up with basically a coefficient that said, if air pollution increases by this much, how much does the mortality rate increase? And those studies were then combined to sort of take an average. And the problem with that was twofold. First of all, in countries like China and India, there weren't any studies that looked at air pollution that high, so they had to make guesses, basically, as to what that sort of slope between air pollution and mortality rates was. And most of the studies hadn't looked at air pollution at lower concentration. And so they were getting this overall average, but it wasn't really that applicable to either higher or lower concentrations, and they made some extrapolations. Well, we did a study where we looked at over 100 different coefficients from studies, and we looked at how those coefficients varied with the average air pollution in the study. And we found that at higher concentrations, the coefficients were lower, but not as much lower as the previous studies had guessed. And at lower concentrations, those slopes were higher. And so when we took that and looked at for the globe, we divided it up into chunks that were about, 50 kilometers by 50 kilometers, and we estimated the impact on mortality rates using the average concentration in those locations. And we did this estimate and only looked at the air pollution from fossil fuels, not from forest fires or other sources. We got a considerably larger number, 10 million excess early deaths in 2012 compared to if there hadn't been that fossil fuel pollution. And it was mostly due to the particles in the air.
Okay. Now, did you look, you mentioned there are problems with certain countries like India and China, and did you look at a great number of countries in general? And
Well, we looked at the entire planet.
oh, you did?
Yeah, we looked at the whole world.
Okay.
And, but India and China have very large populations that are exposed and high levels of air pollution. So, a substantial fraction of the early deaths were occurring in those countries, but there were substantial numbers occurring in the United States as well.
Right, I understand that we're rather high in that regard too. Now, could you, before we get into the actual health effects, could you tell us, like, how do you figure out which particles or the percentage of particles are due to the fossil fuels and which are attributed to other sources? You mentioned forest fires and so forth.
Yes, absolutely. So there are global inventories of how much air pollution, excuse me, particularly particle emissions there are from fires and from stationary sources and from traffic and from all the different sources of air pollution. And they're spatially resolved. It's not like there's one number for the globe. There's one number for each, section of each country. And we used a model that incorporates meteorological data that has wind speeds, for every part of the globe, wind speed and direction, hourly, as well as temperature and other things. And it takes that to estimate, which way the air pollution is blowing. But the other thing it does is a lot of the pollution in the air is actually the result of chemical reactions that occur in the air. And so, for example, nitrogen oxides, which come from fossil fuel combustion, react with various gases that trees put out. Think about that nice smell in a pine forest. That's a compound called pinene. Well, these nitrogen compounds can react with pinene to form particles. So all of a sudden, you wind up with more particles downwind. And the same with sulfur dioxide emissions from coal burning, they turn into sulfate particles. And so the model has all of that chemistry built into it. So it's calculating the changes in concentrations as the air moves along, as well as which way it's going and how fast. And so that gives us estimates of particle concentrations all over the globe. And this is a global model. It's called GeoSChem. And, it's been validated. And we also checked with monitoring data and made adjustments to make sure that it was doing a good job. So we ran geoschem twice, once with all of the emissions going into the air from every source, and then we set the emissions from fossil fuel combustion to zero and reran it again and got new estimates of air pollution concentrations all over the globe. And when you take the difference, that's the change in air pollution concentrations
Right.
due to what would have happened had we not had the fossil fuel emissions. And so that change is an estimate in each location, and it's different in each location,
Right.
of how much came from fossil fuels.
That is very impressive, and I take it that it's like a huge data bank, but over years. Is that true that they keep this kind of data available so that scientists can look at this?
That's right.
That's
Anyone
fabulous.
can download this data
Yeah,
to the internet, but they better have a really big data storage to
right.
hold it. But it is available, and this model, runs on supercomputers, and it
Yes.
runs for days and days to
Right.
get the
Right,
estimates.
right. That's very impressive, and the fact that you can sort out the pollution from the fossil fuels by this database is fabulous. So it's adding to our information about public health now in a big way. People have been talking about this particle pollution for years, but nobody has, until I've seen this study, nobody had targeted or separated out the fossil fuel aspect. Dr. Schwartz, what are the health effects that you have identified?
Well, air pollution actually has a very large number of health effects, and that's because it affects some basic mechanisms in the body that increase your risk of developing many different diseases. So it causes more inflammation in the body, and it causes more, your body is burning food to make energy, right? And so to burn something, you need to oxidize it. And so your body is producing these oxidizing compounds to make energy, but the oxidizing compounds could also oxidize the cell membranes, or your DNA, or all these other things you don't want. And so we have this delicate balance of controlling the amount of these oxidizing compounds, and air pollution has been shown to damage that control, so there are more of these compounds in your body. And so it's not surprising that we see associations of particularly particulate air pollution with higher mortality rates, more heart disease, more strokes, more asthma, more, respiratory infections, more pneumonia. And we also see it with other chronic diseases. So we're seeing it with effects on cognitive function. We're seeing effects on mental health, because we're seeing this kind of inflammation and oxidative damage in the brain.
Right. Yeah, right. To follow up on that, when the earlier studies that I know about the particulate issue, the pollution issue, made a point about the possible impact on the developing brain. So this is particularly bad for, I don't know about during pregnancy, but for children very young as that brain is developing. Is that true, and is that part of your study too?
Well, it's true. We didn't include damages from that in our study because, to estimate the health impacts, we needed some data from every country, like their mortality rate and things like that. And so there were some things that we just didn't have the data to make quantitative estimates. But we have seen particulate air pollution associated with lower cognitive function in children. We've seen it associated with poor performance on, the standardized tests that they do to look at how well kids are learning to read and arithmetic and things like that in like third grade and eighth grade. We and we've also, there are some studies suggesting that prenatal exposure may also be influencing cognitive function in children. So we're definitely seeing a lot of studies pointing to, especially particulate air pollution, having an impact on children's cognitive function.
Okay.
But interestingly, being 76, I'm acutely aware of this, but cognitive function does decline in the elderly, and we're also seeing that exposure is associated with faster rates of decline. So it's hitting at both ends when there's more vulnerability at both ends.
Right. Thank you for that. I wonder also, there's a lot of interest in ADHD now, the attention deficit sort of thing, and there seems to be a spike at this time. And do you think that there might be a connection with this particulate pollution there as well? I know it's not covered.
Yeah, so there's some data looking at air pollution and ADHD, and also looking at air pollution and autism spectrum disorder. So there's definitely studies suggesting that they may be contributing factors. That's not why we're seeing a spike in diagnosis in the United States, however, because there hasn't been a spike in air pollution. Right. So it's merely one of the contributors, but it's not the cause of the observed spike.
Okay, all right. And another thing here, you pointed out in the study that these health effects are occurring at our current pollution level. It's below that even, whatever the standard is for pollution control, it is well below that you're seeing these ominous effects. Is that true?
Absolutely. So EPA just recently lowered their annual average standard for particles in the air from 12 micrograms in a cubic meter of air to 9. But we have done studies where we excluded anybody who was ever exposed to particle pollution above 9, and we still see associations with higher mortality rates, with more hospital admissions for heart disease, etc. So it's definitely occurring at levels that are lower than the US standards, and that's one reason why the World Health Organization set their guidelines to be 5, not 9.
Aha, I didn't realize that. That's quite interesting. But now, to turn to the fossil fuel industry to see what have they had to say about this. They've been in a kind of denial for many years, and they're still fighting to produce fossil fuels. Now that there's no question about the health effects, then what are they saying, if anything?
Well, they're still saying that there are no health
Right.
effects. So they hire consultants who assert all sorts of strange things, that all these studies, which have been reviewed, by the way, by,
Right.
expert panels in the US. They've been reviewed by the National Academy of Sciences, by EPA's Science Advisory Board. They've been reviewed by the UK College of Physicians, by an American Heart Association panel, by a European Union panel, by the World Health Organization, et cetera. They're all wrong.
Yes.
Studies are wrong, and they have various, reasons that they claim show that all of these things are wrong. So they're still fighting tooth and nail in their comments on any regulation, or, even when people violate the regulations
Right.
and they get sued by EPA, they come into the trial and they say, well, yeah, we deny we violated it, but even if we violated it, it didn't do any harm because air pollution isn't bad.
Right, right. And these people, just like to point out, are extremely influential in terms of governments. We have armies of lobbyists here. They have scientists in organizations that are regulatory agencies like EPA and so on. And so it is an uphill battle. What do scientists like you feel about this? Do you have a way to get through to these people or to get past them?
Well, we're not going to get through to industry and the people they hire, right? Because reducing air pollution costs them money, right? And, nobody likes to spend more money on things that aren't important to them. So that's not going to go away. The issue is, can we convince the agencies that set these regulations to tighten standards? And partly that depends on the election returns. So in some administrations, it's easier than others. But what we try to do is to keep publishing papers that address issues that keep getting raised. So, maybe 8 years ago, the, American Petroleum Institute and various other industries kept on saying, well, these epidemiology studies didn't use causal modeling methods. So I went out and I used causal modeling methods and published a large number of papers using causal modeling methods and showing that I'm getting the same result. So the older studies aren't wrong, and the newer studies use these methods and they get the same thing, right? So part of what we have to do is keep an ear to the ground and say, what are the arguments that are being used, and try to address them. Or one of the arguments is, well, there are all these individual risk factors that you haven't measured in these studies. So I did an analysis where I took people who had died and they matched them to a nearby years when they hadn't died. So it's the same person. They have the same cholesterol level, their blood pressure. Everything's the same. And I said, well, was the air pollution higher on the years they died or the years they didn't die? And it was higher on the years they died. So that addresses that. So that's what we got to do, and we need to then try to get the message out to the public as well, because the public puts pressure on their representatives, and so that matters to government agencies that are setting regulations.
Yes, that's very good information. Thanks for that. There are a couple of things there that it sounds as though you need to educate somehow people that represent the public, that is our government officials. The other is to educate the public so they are aware that some of the objections to the studies from the fossil fuel industry they're not correct, and so that people can protest a little more. But science today, it seems to be complicated for a lot of people, and so there's a big problem of how to educate the public and how to educate our representatives, both of them, I guess. But in any case, thank you for your efforts on that score. And we have a few minutes left, and if you would not mind, I would like to tell the audience that you did, I believe with your colleague wife, a huge study on lead. Lead is back in the news again now. Oh, we will get rid of those lead pipes, blah, blah. But in any case, when seeing that this is back again, I can't resist asking you if you would just give us a little bit of information about your rather famous study on lead.
Okay, well, there are actually two.
Yeah.
One is way back in the 80s when the public health community basically thought that, the problem with lead was only with lead paint, and certainly lead paint is a major problem, and I was working for EPA, and I did studies showing that most of the lead in people actually came from lead in gasoline. And I drafted the regulation that EPA actually put out and finalized that resulted in getting rid of the addition of lead to gasoline. And so that got rid of lead in gasoline. And, in 1976, the average blood lead level in Americans was about 17 or 18 micrograms of lead in a tenth of a liter of blood. And now it's about a tenth of that. And then this most recent study is that, well, where is the remaining lead coming from? And for a long time, the pipes that connected people's homes to the water mains in the street were made out of lead because lead was soft, it was easy to bend it, and it, lasted a long time. And so, whereas an iron pipe might corrode faster. So we have all these lead pipes there. Now, you go to sleep at night, the water is sitting in that lead pipe for 8 hours. You get up in the morning, you brush your teeth, you make some coffee, the water is coming out of that pipe that's been sitting there surrounded by lead, and water is corrosive, so it corrodes a little bit of the lead out of the pipe, and so there's lead in drinking water. Not that it started that way, but because it was sitting in these lead pipes. And EPA's water office was proposing to at most require that about 5% of those pipes be replaced. And what we showed was that if we just took the health effects of lead that EPA had and its Science Advisory Board had determined were causal, and we estimated what the health effects were and the monetary damages associated with them, that the benefits of replacing all of the pipes were like, 10, 20, 30 times more than the cost. And so, and we made that public and we got EPA to change the rule to require that all of these lead pipes be replaced in the next decade.
Yeah, and it was a long fight, and it still is. I'm so sorry. I'd like to hear more on that, but thank you for that. And I'm sorry, but we're just about out of time. And I just want to thank you very much for joining us today. I know you have a busy schedule, and that we really appreciate this information. I hope people will be able to use it to put pressure on representatives and get something done with this. Thank you so much, Dr. Schwartz.
You're quite welcome. Thank you.